I offer my humble pranams at the lotus feet of our beloved Bhagwan. Sairam to all. Thank you for joining us for today's healthcare webinar on back pain. Today's facilitators are Dr. Arul Srinivasan and Mr. Anbu Jayakumaran. Dr. Arul works as a consultant rheumatologist at the Mid and South Essex University Foundation Trust. She has several research publications in the field of medicine and is the author of a chapter on chronic back pain in the textbook of Management of Spine Disorders. She has given several talks on various musculoskeletal conditions at regional and international levels. Dr. Arul has served on many medical camps with Dr. Upadhyay and team and says each one has been a blissful experience. She is currently the Region 3 President. Having been in the site board since 1968, Dr. Arul prays to Swami to use her as his divine instrument to serve the needy in any capacity. Mr. Anbu Jayakumaran, MPT, MCSP, respiratory specialist physiotherapist, and independent prescriber in Essex. Brother Anbu qualified as a physiotherapist in 1998 and completed his master's in 2002. He has been working for 15 years in the NHS and has a great passion for respiratory care. He currently works as an oxygen specialist physio in Essex. Brother Anbu has been an ardent devotee of Sri Shirdi Sai Baba since 2006 and continuously tries to follow Baba's preachings and sees him in all. His favorite quote of Baba is, "Do not entertain the sense of doership in doing good or bad deeds. Be entirely without pride and without ego in all things, and your spiritual progress will be rapid." I pray today's webinar will be of help. Please keep safe and look after yourselves. I now hand over to Dr. Arul. Jai Sairam.
Brothers, sisters, so let me share screen. Okay, I'm just going to talk on back pain, which is a common ailment that we come across in a day-to-day life. A majority of us have experienced back pain at some stage in our life. And in the GP practices, they might see at least one patient with back pain a day in most of the GP surgeries. It is that common. I'm just going to speak about the causes, prevention, and treatment of some of the of simple back pain in particular, but I will mention all the serious form of serious conditions that can result in back pain. What is back pain? It's a very common condition, as I mentioned. It usually affects 4 out of 5 people at some point in their life. Lower back pain is very common, but the pain can be experienced any place from neck down to the hips, and it can sometimes affect the whole of the spine. This is the structure of the backbone. Backbone or the spine is the strongest part of the body. As you can see here, it's divided into cervical spine, thoracic spine, or lumbar spine. And the other areas which can also be considered as back pain is where the spine joins the pelvis or the hip bone, called the sacroiliac joints, and the tip of the spine, which is the coccyx. And there are altogether 24 bones sitting one on top of the other form the spine. There are cushion pads, which are called discs. They are separating the bones, and they act as shock absorbers. And when you're jarring the spine, like running or doing any heavy activities, these protect the spine by acting as cushion pads. The pain can come from anywhere in the spine, like bones, discs, or the nerves. On both sides of each bone, there are small joints which connect one bone to the one on top. And these are called the facet joints. And these are joints that can get worn out as we get older, and it can also get inflamed. The spinal cord, which is the end bit of the brain, which comes down the spine, and this is well protected in the bony canals in between the bones of the spines. The nerves or the nerve roots pass at the back of the spine, in between each bone and around the disc, and they supply different areas of the body. Several ligaments and muscles support and hold the bones together. And these are very thick muscles and thick ligaments, which are very, very important. And they play a big role in carrying the body weight and assisting in mobility. Simple back pain is the commonest. These are mainly muscle, tendon, or ligament strain. Just like you have a ligament strain or sprain of the ankle or the wrist, this is very similar. And this happens because of poor posture, especially when we are sitting with the back bent or in an angle. This can happen. And lifting heavy weights inappropriately, like bending down from the hips and lifting on one side, all this can strain the ligaments or the muscles at the back. Lack of exercise can result in weakening and wasting and straining of the ligaments and muscles. Just like the bones or the joints, the muscles also can get worn out as we get older. So it is very important that you keep exercising to keep the muscles strengthened and prevent stiffening of the spine as we get older. Wear and tear of the discs and joints, which is called spondylosis, and this should not be confused with spondylitis, which I will come to later, which is an inflammatory condition. This happens to most of us as we get older, and this is a normal aging process. Not everybody with the worn spine will get pain. That is something that we need to remember. If your muscles are strong and if you're thinking positive and doing all the activities, then your pain level is very, very low and you may never get pain from the spine. Some conditions like increased flexibility, hypermobility, we call it, where all the ligaments are long but not strong, and they are very flexible. Some people are very flexible. And those who have scoliosis and other structural abnormalities of the spine from birth also can get into back pain situation more than a few times in their lifetime. Nerve root problems are the most important that people go to the GPs, mainly where the nerves are being caught or irritated. Most of us know about sciatica, and this is due to the discs here in between the bones, and this can either bulge out or they can even come out, slip. And these mustard yellow structures are the nerves, and as you can see, this can be pressed very easily. The other reason why the nerve roots are caught or irritated is these are the facet joints where one bone joins with the other on top, and these can get worn. And when any joint that gets into wear and tear tends to grow bigger, and they also grow spurs, which are pointy structures, and they can also irritate the nerves. And in sciatica, the pain tends to travel to the leg and to the foot, and there may be some pins and needle sensation and numbness that can be experienced when you have sciatica. And sorry, this is not going further. You, the other serious rarer causes are you can crush the bone, and usually this happens in older women, and normally the bones tend to heal within 6 weeks. And but if once this happens, then you most likely you have osteoporosis and you need further investigations. And some conditions like inflammation of the spine, called ankylosing spondylitis, which is a rarer condition. This can be a complication of psoriasis or inflammatory bowel disease. And infection also is another rare cause. In inflammation, you get mostly stiffness, and it affects the lower joints, which are called the sacroiliac joints. And you may need blood tests and MRI scans to identify this. Infection can be through the blood. It can come from chest infection, throat infection, or water infection. And it can affect the bones, called osteomyelitis, or it can affect the discs with discitis. Tumors are very, very rare. And the benign tumor is osteoid osteoma, which causes night pain in one area, doesn't need treatment, but can be removed if necessary. And the other tumors, the cancerous tumors, are tumors that come from other cancers like lung cancer, prostate cancer, breast cancer, kidneys, or from the thyroid. These are the commonest tumors, that cancerous tumor that we see, but it could be primary tumor from the bone itself called sarcoma, or it could be bone marrow cancer, which is a multiple myeloma, or it could be other cancers like blood cancer, leukemia, or lymph node cancer, lymphoma. All this can affect the spine. In infection of the spine, they do need long-term antibiotics, 2 weeks of intravenous antibiotics, and then oral antibiotics for a few months. And for what you can do to help the pain, you can take ordinary painkillers or anti-inflammatories. Your pharmacist might tell you which is safe for you in case you have tummy problems. Sorry about that. Yeah, I'll just share screen. Yeah, in case you have tummy problems, the pharmacist will help you to and advise you as to what you could take. And you can use hot and cold compression packs from the pharmacy, which you can get, or you can use hot water bottle or a bag of frozen vegetables. But when you use a frozen vegetable, always make sure you wrap it in a cloth or the towel. You should stay as active as possible and try to continue with daily activities, which is the most important thing that you can do when you have pain. Do not rest for long periods, and as this is likely to make the pain worse by wasting the muscles. Try doing stretch exercises for the back pain. You can do walking, swimming, yoga, Pilates. All these are very helpful. Always make sure you check your posture, and you make sure you lift heavy objects correctly, and not like this where you're bending at the hip, so you can prolapse the disc or strain the back. So you need to bend at the knee and lift it so that the weight is spread on both sides of the arms. Again, losing weight is very important because back is a weight-bearing joint, and you can strain the back by body weight. And do not use belts, corsets, or even lumbar supports. And if you need to use it, no more than few days, because when you use it longer, this will waste the back muscles. And of course, healthy diet and exercises are very important. Coming to posture, I mean, we all use computers all the time, and it is very important to keep the back straight. And it is a comfortable position. Sometimes we might feel bending forward like this, but that is going to strain the back, strain different ligaments of the back. And again, but curving the spine while you're sitting at the desk is again not a good idea. Always make sure you have the good chair where you're sitting upright. When you're lifting objects, as I mentioned, bend at the knee and don't bend at the hip to lift it. And while you're waiting at the supermarket or for the bus, you're always using your phone, and make sure you're standing upright rather than bending. Meditation, relaxation, and being happy is very, very important. Meditation, you develop a very good posture with the back being straight, and you're keeping your mind calm and taking the mind away from the pain, and you are generally calming yourself by doing meditation. Relaxation is also very important, as stress can make the back pain worse. So you need to learn to relax completely. Most of the time, at least for when you have the back pain, try and relax and get your mindset correct. And never get depressed because of the back pain, because most of the time the back pain can be treated and it can go away. And try not to get depressed, and try to stay positive and happy. And when do you have to see your doctor? And that is a very important question here. When you can see the doctor, it is mainly when you have pain lasting for more than 3 months. And that is if you have continuous pain, and the pain doesn't go away, it's affecting your day-to-day activities, then you need to see your doctor. If the pain is going down the legs, as the nerves could be trapped or irritated, like sciatica, and if this is not settling for more than 3 months, then you need to see the doctor. Again, losing control of the bowels or waterworks, again, is a very important sign, goes to show that your spinal cord is being affected or trapped. So you need to see the doctor. And if you're developing numbness around the back passage or the genital area, again, this is a red flag sign where you need to see the doctor. If you feel your legs are getting weaker and becoming unsteady and if you're becoming unsteady on your feet, and do go and see your doctor. In the middle of the back, that is the thoracic spine, normally you don't get pain often. And if you get this pain, and if it's persistent, and if you're getting pins and needles going around the chest, or pain going around the chest, then it is again a reason for you to go and see your doctor. What will your doctor do? I mean, he's going to examine you, and he can give you medication to relax the muscles of or the nerves for simple back pain. He can arrange blood tests, x-rays, or even a scan. And if necessary, your doctor will refer you to the physiotherapist, where you can learn exercises and you can start doing them regularly. And or to an osteopath, you may be able to see an osteopath for mobilization and of the joints, to make the joints supple. He may refer you to a rheumatologist, orthopedic surgeon, or the pain team. Some GPs have access to the cognitive behavioral therapist, which is also very important to adjust your mind to pain. This is to take the mind away from constantly thinking about pain, and to control the pain in your mind. If your GP doesn't have access, the pain team will have access to cognitive behavioral therapy. When does the pain become chronic? It is mainly when you avoid activities, especially sort of staying in bed for long with pain. And then in this case, the pain can become chronic. And also this can result in muscle wasting and weakness, and it reduces your confidence and causes depression. You feel Your family members and even the doctors are being unsympathetic because you're constantly thinking about your pain. It becomes bigger and bigger and bigger in your mind, and you feel others are not giving that much importance. And your activity level also starts to reduce further because you're staying in bed and you're getting depressed. And this is the pain cycle which you need to get out of. Number one, you have the pain and you have a fear of any activity, and then you get depressed because you're not doing anything, and you feel you feel the pain more because you're staying in bed thinking about the pain, and you avoid more activities because you still think that you've got a bigger problem. You become anxious, your mood gets low, you get very depressed, and in depression you feel the pain more, and your muscles get weaker, and this cycle goes on. And only 5% of patients need treatment for serious back problems. Mainly, they may need tablets or injections, such as some specific medication for inflammation and infections. Steroid injections can be given into the facet joints to help you start exercising to reduce the pain initially, or you can have epidural for disc bulges or constant pain. Nerve blocks can be given to block the nerves that are being irritable, and surgery is also needed in some cases where the nerves are completely trapped and where the spinal cord is trapped or there is any other tumors. In summary, more than 95% of back pain are simple back pain due to muscle and ligament strain and wear and tear. Exercises and stretches are the main treatment here. Painkillers and heat or cold pack can be used to relieve pain. Never stay in bed for longer than necessary for more than a day or two. Try to keep active at whatever level you can. And do not use belts, corsets, or back supports for more than a few days. Always stay positive as the pain will get better in a few weeks. You need to see your GP. If you have leg pains, you get pins and needles and numbness in the legs. You start to get bladder or bowel problems or sensory loss at the back passage. If your back pain is severe and progressively getting worse, or stiffness becomes the predominant symptom, where especially affecting the whole of the spine or thoracic spine. Now, I will pass it on to Brother Anbu, who's going to discuss and demonstrate the exercises for you, which is the more important part of this topic today. Thank you for listening.
Saram and pranams to everyone. Let me share the screen. Sorry, everyone. Apologies. So back exercises.
So why exercises? I would like to reiterate what Dr. Arul has mentioned. Spine is one of the strongest parts of our body, and it gives great deal of flexibility and strength. It's very important to remember heart is not equal to home. And most importantly, bed rest is bad for backs. If you're in acute pain, it's okay to rest for a day or two, but it's very important you get moving sooner, doing your normal activities as soon as possible so that you feel better soon. Remember, activity is good and back is designed for movement. We all know exercise is important to keep the muscles strong and the joints flexible. So what if you don't do exercises? With any back pain, any mechanical back pain or acute back pain, the first onset is the fear. And what we do is we try to reduce the activity, thinking that we might make or worsen the back pain. So that fear causes reduced activity, and we rest. And if you rest, what happens? You weak your muscles, your bone get weaker, and your muscles and the ligaments and the soft tissue structures get stiffer. You become less fit, and you may feel depressed, and you feel more pain, and it's eventually becomes harder and harder to get going. So it's very important to start moving. So as Dr. Arul mentioned, exercise is the first step to get better from back pain. So this evening, we are going to cover some basic back exercises that would help to keep your back supple and stronger so that it can do its job. So the first exercises that we've got is like when you have any acute back pain, you just lie, face down with your arms relaxed beside your body. Turn your head to one side and relax your neck and shoulder. Try and take some deep breaths, bringing your attention into the most painful areas of your back and body, and then breathe out evenly few times and relax. So you can start off with few minutes, 2 minutes, and then gradually build it up, even up to 10 minutes each session. And you can do this 6 to 8 times a day. And the next exercise is a slight progression of what we did. The lying face down is prone on your elbows. So lying face down. So lean on your elbows and forearms. Take some deep breaths. Again, bringing your attention to your back, lower back. Imagine you're breathing into your back, hips, legs, and allow your muscles to relax as completely as possible. Then breathe again evenly out for a few minutes. And you can repeat this few times. Always, it's for any exercise, remember to start low and gradually build it up. And at any stage, if any exercise make your pain worse, just please stop it. Okay. And the progression of that is back extension. So I've got a video for this exercise. Lying face down with both your hands at your shoulder height. Straighten your elbows and lift your upper trunk as far as you can. Key thing is keep your pelvis and legs relaxed. You could do this again, begin with 5 times and gradually build it up to 10 to 12 repetitions each set. And you can do few times, 3 or 4 times a day, and gradually build it up the sets as well from 1 set, and then you can do 2 sets each session. So here, lying face down, hands at your shoulder height. So gradually straighten the elbows and lifting the trunk up as far as you can. And remember to keep the pelvis and legs relaxed. And you do this few times. Again, 3 or 5 times begin, and then gradually build it up. Right? Thank you. Then next, moving on. The next exercise we got here is your knee rolls. So again, I've got a video for this. So you lie on your back with the knees bent, feet flat on the mat. In a controlled manner, move your knees from side to side, but go only as far as you can without moving your shoulders or letting your back arch. We can watch the video in the next slide. I'll repeat that again. So lying on your back, knees bent, feet hip width apart, on feet flat on the mat. Roll your knees gently side to side, really as far as you can. Rolling your knees gently side to side, but only as far as you can, keeping not moving your shoulders or letting your pelvis arch. Again, you can do this exercises few times, 3 or 5 times, and then you can and gradually build it up to 10 repetitions each set and few times a day. And moving on, another important exercise is what we call as pelvic bridging. Again, in this exercise, you lie flat on your back, knees bent, feet hip width apart, flat on the mat, and draw in your abdominals, tighten your buttocks, and tilt your pelvis backwards and lift your pelvis and back up 1 vertebrae at a time. Lift only as high as you can while maintaining the pelvis position. And then it's very important to lower your pelvis down in a controlled manner. And it's very important not to lower the back arching during the lift. We'll watch this video again. So lying flat with the knees bent, feet hip width apart and flat on the mat. So draw in your abdominals, tighten your buttocks, and lift your back 1 vertebrae slowly, and then without letting your back arch and dropping down in a controlled manner. Another exercise is what we call cat and camel exercise. It's for it helps to mobilize your spine, what we call flexion extension. It's bend and straighten your spine. So for this exercise, you get on your hands and knees, hands under your shoulders and knees under your hips, round and arch your back by tilting your pelvis backwards and forwards. And you repeat this 5 times. So on your fours, hands and knees on your fours, hands below your shoulders, knee below your hips. So round and arch your back, tilting your pelvis backwards and forwards. And you do this few times. So hands on knees, hands under your shoulders, knees under your hips, round your back, and then now arch, curve your back, tilting your pelvis forwards and backwards. Again, you begin with, 3 or 5 times, and then gradually build it up to 10 to 12 repetitions. And you can do this few times a day, 3 or 4 times a day to begin with, and you can increase the sets as it becomes easier for you. The next exercise is your extension exercises. Again, spinal extension. So you lie face down with your arms by your side and lift your upper trunk while looking at the floor and hold approximately for 5 seconds. And you repeat this again 5 times. Got a video footage to play. So you lie face down, hands by your side, lift your trunk up as far as you can comfortably, and lower it down. And you repeat this few times. Begin with 3 or 5 times and then gradually build it up. Another exercise to mobilize or to loosen your pelvis joint is the backward pelvis tilt. It's very, very important. So to do this exercise, you just stand tall, feet hip width apart, and arms supported on your hips. Keep your knees as straight as possible by tightening your buttocks, pulling your abdominals in, roll your pelvis backwards. That's round your lower back, curve your lower back. And you repeat this 5 times. Sorry, Sarah. So stand up tall, feet hip width apart, hands supported on your hips. Tighten your buttocks and pull your abdominals and roll your pelvis backwards. And you repeat this few times. Stand up tall, feet hip width apart, knees nice and straight. Tighten your buttocks, pull your abdominals in and roll your pelvis backwards, tilted backwards. So those are the few mobilization exercises. Next, we are moving on to the strengthening exercise for your back. This is a very, very good exercise to strengthen your back muscles. I wouldn't advise someone starting this on the day 1 when they are in acute pain. Maybe after a couple of days when they have done these mobilization exercises, get a bit of flexibility in the back and then move on to this strengthening exercise. So again, lie on your stomach, neck in neutral position, arms straight above your head, draw in your lower abdominals, lift one arm and the opposite leg and hold. Initially, if you find it hard to hold, even you don't have to hold it, just lift it and bring it down slowly. And then after a couple of days, try to, hold. And once you have done, for example, you lift your right arm and the left leg and then bring it down. And then the next time the left arm and the right leg. What is most important to note is instead of trying to lift as high as possible, just try to focus on lengthening your left arm and leg. So lying flat, lying on your tummy, hands straight above your head, and lift your right arm and left leg. And try and hold it for a few seconds if you can. If not, just bring it down in a controlled manner and then right arm and left leg down slowly. You repeat this few times on either side. So if you find it hard to hold at the beginning, so just lift and lower it, and then a couple of days you should be able to hold it. And when you hold it for few seconds, begin 2 to 5 seconds. When you hold the posture, you hold the body parts, but not your breath. So please focus on breathing out when you hold your, when you hold the exercises. That's very, very important. And I've got the last one of the stretching exercises. Not that many will be able to do it, but if you can do it, you can please do this. This helps to stretch your back muscles. So lying with your knees bent and feet on your floor, lift your knees towards your chest, place your hands behind both knees and draw them towards your chest, and you hold for 5 seconds. And repeat this 5 times. So lie on your back, knees bent, hands behind the knees, and bring your knees to the chest as far as you can comfortably, and hold it for a few seconds. As it's a stretching, you can hold for, begin with 5 seconds and aim to hold for 20 to 30 seconds. Okay, but don't hold your breath, hold the stretch. But when you hold the stretch, you focus on breathing out, exhaling. Don't hold your breath. Okay, so let me repeat the knee to chest, back stretch, lying on your back, hands behind the knees, pull and draw your knee towards the chest and hold it for from 5 to 20 seconds or longer if you can, if you wish. And most importantly, do not hold your breath. To recap, the benefits of exercises. Exercises helps to stretch your muscles, strengthen your muscles, and stabilize the joints. So when we do the exercises, our body releases the hormones, happy hormones like endorphins. They are the natural painkillers, and this helps to, make feel your pain a lot less. So regular exercises, if we involve doing regular exercises for 20 to 30 minutes of moderate intensity for 3 to 5 days a week, make your back supple, stronger, so that, and it leads to shorter and less frequent episodes of back pain. And please choose the exercise that you enjoy the most, so that you will continue for longer. If you just follow some exercises, then you may not like it and you may not do it for long term. So pick the exercises that you like the most, and carry on. So the choice is us, whether to rest and get worse or stay active and recover. Thanks for listening. Om Sai Ram.
I offer my Sairam, I offer my humble pranams at the lotus feet of our dear Bhagavan Baba. Thank you so much, Dr. Arul and Brother Anbu, for the brilliant presentations. We will now move on to the question and answer session. We've got a few questions posted to us. This was covered, but for brief explanation, please. Would you please explain about sciatica pain and how to ease the pain?
Right. Sciatica pain is a nerve root pain. It could be due to nerve irritation or due to trapped nerve completely. It can be trapped fully. And the pain is usually goes down one leg. Commonly, it's one leg. It goes down up to the foot, and sometimes you can experience pins and needles as well with that. And the first thing that you need to do is not to stay in bed with sciatic pain. Start moving, doing day-to-day work, and start exercising. You can take ordinary painkillers or nerve relaxant or muscle relaxants, like drugs like amitriptyline. Your GP will be able to prescribe these drugs for you, and taking those, it will relax the nerve and will help you with the pain, and also will encourage you to exercise, because otherwise with pain, most people tend not to exercise. So you need to start stretches and continuous stretches, and it may take a few weeks at the most, and it'll usually resolve if it is just a nerve irritation. But you need to continue with the exercises for much longer to keep the muscles and ligaments stronger at the back. If it is persistent and you're losing the power or the sensation completely in the leg, then you need to go and see your doctor, because this will need further investigations like MRI scan to see how badly the nerve is being trapped.
Thank you, Dr. Arul, for that. Thank you. Another question, should I stop yoga because of my back pain?
No, I don't think that would be recommended, but you can do less because you may not be able to do all the yoga stretches when you have back pain. So do whatever you can, but do not stop. But start off with the lower level and gradually build it up. It's graduated exercises is what's needed, and graduated stretches. You may not be able to do the same stretches, yoga stretches, which you did before you developed back pain, but you can get to that level again if you gradually increase it.
Thank you. What are the risk factors for developing lower back pain?
Okay, the commonest one is weight, and as we get older, and lack of activities like back strengthening, and slowly you do get the back discs, the lower discs particularly, as they are weight bearing, they can get worn. But there are some conditions like hypermobility, where your muscles are and ligaments are longer but weaker, and that is a hereditary condition. They can also get back pain easily because they can strain the back muscles, so they again need to strengthen it. And some conditions, people are born with scoliosis, curvature of the spine, and they also need to do for a bit more exercises than usual to keep the back strengthened.
Okay, thank you, Dr. Arul, for that. What complementary therapies are available to manage back pain? When to access them?
Right. Okay. Some therapies, like, you can have acupuncture, which can give you relief to some extent. The reason that I'm saying that you can try those is mainly, when you have the acupuncture, you get temporary pain relief, and you will be able to strengthen and exercise better, because with pain you don't exercise. That is the main reason that I would recommend acupuncture, but not in the long term, so that once the pain is relieved, you start exercising, and then you can continue with that. The other complementary therapies, there are other mainly medication, herbal medications people try, like ginger and apple cider vinegar, all that for wear and tear. Sometimes it does work, and weight reduction is another major important thing that I would insist on. So apart from that, there is not a great deal. It is mostly in your hands to do exercise. Yeah.
Yeah, that's great. Thank you. What is the point at which one should seek a hospital referral? I have thoracic radiculopathy since last 4 months that settles with exercise and good posture, but keeps coming back. Never saw a doctor and managing this myself.
Okay, thoracic pain, that is a pain in the middle of the back. If it keeps coming back, we always advise to go and see the doctor, because it is not a common area where you get back pain, because that is not where the whole of the body weight goes. It's the lower spine that takes the body weight. And in thoracic spine, there are other conditions like nerve irritation, and even sometimes sinister pathology can be a cause. So that is why we advise everyone who gets persistent and recurrent thoracic pain to go and see the doctor, because an MRI scan will be needed if the pain is in the middle of the back.
Another question. What happens if the lower spine is becoming weak and brittle, and what can we do about it at the beginning? It hurts more when you do quick walking.
Okay, the thing is, there are other conditions. The brittle bone is only will make you fracture, But if it's getting weaker, that means your muscles are getting weaker and the bone is getting into wear and tear situation. Because wear and tear starts to happen from 25 years. But then if the muscles are strong, you can manage it. But what is the second part of the questions, Sister Senta?
Yeah, so the second part, it hurts more when you do quick walking.
Okay, there is one other condition called spinal stenosis where the nerves are trapped or the spinal cord can be trapped. This pain comes on when you're walking and it is relieved by rest. And it is not always the back that you have to blame. Sometimes the blood vessels and the blood supply can be low, and that also can cause the same problem. Blood supply to the legs can also cause the same problem. But if you have a problem, like if you're walking, you're getting the pain, which is relieved by resting, and then you can start walking again, then I would recommend that you go and see your doctor to get a scan done to see if the spinal cord is being trapped at all.
Thank you for that. One more question. I have groin pain on the right and was told I have lower back arthritis. I am in a lot of pain. Should I get ultrasound done or MRI scan?
Okay, if the pain is in the groin, sometimes you can get referred pain coming from the lower back. Lower back arthritis is wear and tear in most cases. Inflammatory arthritis is quite rare, and I think in which case your GP would have already referred you. If it is wear and tear arthritis, and if you're getting referred pain coming into the groin, and your doctor thinks that it is coming from the back rather than groin as such, because there are lots of muscles in the groin which can get strained anyway, in the hip muscles they are. And that is also a possibility. If the groin pain is the major issue and there is not much of a low back pain, then an ultrasound of the groin will be a good idea. But otherwise, I would recommend a lower back MRI scan if it is a referred pain coming from the back. It depends on where the pain is more. If it is just the groin pain, then go for an ultrasound. If it is the lower back pain, go for an MRI.
That's really good. Thank you, Dr. Arul. For Brother Anbu, just a question. You showed some brilliant exercises. Where can people access those? If they want like a referral, where can they access that? Would you recommend any websites or videos?
They can follow these exercises that we share. And people, wherever they are, they would have the musculoskeletal services, physio services, and they could self-refer themselves. And while they wait to see a physio, they'll be sent out the basic exercises like the ones that we covered today. And they can start those exercises. As I said before, if any of the exercises make the pain worse, let them stop and seek the physio opinion.
Thank you for that. Just for information, I work in Bristol, and in Bristol we use a website called Get You Better. Yeah. So I'm not, I don't know whether it's available nationally or is it just for Bristol?
Yeah, it's locally. All the even in Essex they have the different sites, and Suffolk they have back HP. So there's different for each locality. So your concerned GP surgery should be able to put you in touch with the team.
Correct. Yes, I think it's if people can access those through their GP.
Yeah.
Yes. Okay. Thank you very much. I think we've covered all the questions. That was really informative, and there were lots of really practical points, and the exercises you showed were really useful. Dr. Arul, it was really informative, very lots of useful, good information. I would like to thank Dr. Arul and Brother Anbu for their excellent presentations. A big thank you to Brother Tushar for all the sort of IT support, and Jayesh Bhai for the introduction, and Dr. Upadhyaya for guiding and supporting us, and to Sister Gayatri for coordinating all these webinars and for all the background work she does so tirelessly. And thank you so much. And thank you all of you for joining this session. And we really hope that you found this informative and practical. So our next webinar is scheduled for the 6th of July, which is a Tuesday, same time at 8 p.m. The topic is common pediatric problems. So please join us. Sai Ram. Thank you to all. Sai Ram.